Have you ever had that burning sensation in your chest, especially after a meal? Well, that could be acid reflux. And I'm here to tell you today that you can fix it with more than just medications. Hi, I'm Dr. Micah, you board-certified integrative rheumatologist. And today, we're going to be focusing on the herbs and supplements that can help with acid reflux. First, let's start with the basics. GERD is a scientific term for acid reflux. And that's when the stomach acid flows from your stomach all the way up to your esophagus. And that's what causes the burning sensation that you feel in your chest. And the esophagus is a tube that connects your mouth to your stomach. And that's where all the food flows through. So when stomach acid goes up the esophagus, that is not normal. You don't want that. The stomach acid needs to stay in the stomach. Because if you have too much stomach acid going up to your esophagus, it can eventually erode the esophagus and potentially cause cancer in the esophagus because it could change the cell type. There are common triggers to acid reflux, which can include lying down right after you eat. Some people it's coffee, others include fatty foods or smoking, greasy meals, spicy foods, and also some people it's chocolate. These foods can relax the sphincter between your esophagus and your stomach because that sphincter between your stomach and your esophagus needs to be very tight. So when it gets loosened, it increases the risk of acid reflux and that burning sensation that we all hate. And the risk of acid reflux can be beyond just food. There are risks of being overweight, alcohol use, and other medications can also increase risk of acid reflux. And as I said earlier, we don't want that acid reflux to go to our esophagus because there are risks not only with potential cancer, but you can get ulcers in the esophagus as well. And that can be really painful and difficult to treat. In this video, I'm gonna go over the herbs and supplements that we can use to help fight acid reflux. But before I do that, I'm going to talk to you about the side effects of using proton pump inhibitors, or also known as PPIs. So when you go to your doctor and you tell them you have acid reflux, they will give you a PPI or something very similar to that. However, there are consequences to using these medications. The short-term side effects could be nausea, headaches, and abdominal pain, which isn't too bad for something that can give you relief. However, the scary part of long-term PPI use are the long-term side effects, which is why I made this video so you can be educated on ways to maybe minimize the use of PPIs. When you take PPIs, it can alter and decrease the absorption of certain vitamins and minerals in the body. So it can lead to unintended consequences of lowered vitamin and mineral absorption. Another long-term side effect of PPI use is weakening of the bones and potential fractures. There have been studies on this, and there is evidence that there can be increased fractures from long-term PPI use. That's why I don't like to give this long-term if I do give it to patients, and I try to strategize with patients to find ways to come off these medications. And part of the risk of these fractures is from lower calcium absorption. That's one of the reasons why there can be increased risk of osteoporosis and fractures with long-term PPI use. Some studies have shown that there is an increased risk of GI infections such as C. diff and possible pneumonia with long-term PPI use as well. That's something that your doctor may not share with you, and they may not even know it because they don't look into the long-term side effects of PPIs. Some studies have also mentioned that there can be increased risk of SIBO, also known as small intestinal bacterial overgrowth, which can be difficult to treat and can keep coming back, and that's treated with antibiotics. And you can give herbs as well for that. Other side effects that can happen include increased risk of dementia, increased risk of kidney disease, and also increased risk of heart disease as well. There are studies to back this up. Of course, it's not 100% conclusive, but you need to be aware that there are risks with PPI use. So just be careful. If you need it, then you have to take it. But there are ways to maybe lower the amount that we take. And that's what I'm going to talk about in this next section, which is the exciting part, the herbs and supplements to lower acid reflux symptoms. Okay, so let's talk about the herbs and supplements we can use to treat acid reflux. Number one, we can use slippery elm. So what is slippery elm? So slippery elm is a tree native to North America. And it's also known as Ulmus rubra. And it can form a soothing protective coating on the esophagus, lessening the irritation from stomach acid. And there's some evidence that it can increase the mucus production as well, leading to relief from acid reflux. Now here's one that might surprise you. It's melatonin. We know we can use melatonin for insomnia and difficulty sleeping, but did you know that melatonin can potentially also help with acid reflux irritation? Well, how does that even work? Well, the melatonin can potentially help strengthen the sphincter, especially the esophageal sphincter. And that's the valve that I talked about between the stomach and the esophagus. And a stronger esophageal sphincter can lead to less acid reflux flowing into the esophagus and keep it in the stomach where it's supposed to be. All right, this one is my favorite, licorice root. This is one of the first supplements I learned about in my integrative medicine education for acid reflux. And how does it work? Well, licorice, not the candy kind, do not eat the candy kind. We're talking about the supplement here, the herb. The way it works is that it can promote mucus production, similar to slippery elm, and that can give it some relief for the acid reflux. And it has some anti-inflammatory properties as well. So when you look for supplements, it might be called DGL, or I'm not gonna even try to say this, deglycerinated licorice. It's a long word. DG is a very long word. You guys can look it up. I can barely pronounce it. But you wanna get the DGL type and not regular licorice root, because regular licorice root can raise the blood pressure. So you gotta be very careful if you have high blood pressure already. Another supplement that can potentially help is called mastic gum. Not the chewing kind, but the herb and the supplement. There are some small studies that show that mastic gum can potentially help with gastric ulcers and acid reflux. So that's something you might want to look into as well. Another potential supplement that can help with acid reflux symptoms is marshmallow root. Again, there are just weird names coming up with these herbs and supplements that might confuse you because they sound so tasty. Marshmallow, licorice, they sound like candy and sweets, but they're really not. You gotta be really careful. If you eat the candy, you might exacerbate your symptoms. So we gotta get the supplement, not the food here. Marshmallow root can help with the lining and potentially increase mucus production within the esophagus. So it can give some relief also. So hopefully from this section, you have developed some tools you can use to fight acid reflux beyond just the medications you're on. And you're probably asking, can you combine these supplements and herbs with the medications for acid reflux? Potentially, you gotta talk to your doctor, but I have personally done that before. And before we consider medications, herbs, and supplements, we gotta examine our own lifestyle, making sure that we minimize the risk factors to developing acid reflux symptoms or GERD. So we want to eat smaller meals, elevate your head of the bed if you eat right before you go to sleep or take a nap. Don't eat late at night, and also avoiding your food triggers if that's chocolate, spicy food, fatty foods, or coffee. If you are on a PPI and you want to get off because of the long-term side effects, there are a lot of ways. You can use herbs, you can use supplements, and you can use lifestyle modifications if you know your triggers as well. So there are many tools beyond just medications that your doctor is not going to tell you, but it can work. So working with an integrative doctor like myself, I help patients sometimes come off of these medications, because who wants to be on medications lifelong? So not only am I a rheumatologist, but I work with my patients on other ways to come off the medications with long-term side effects. It's really an art when you combine alternative medicine with conventional medicine. It's really fun. So I want to hear from you. Do you have acid reflux or GERD? What do you do to minimize your symptoms? Are you taking any of these supplements? What you're experiencing? Do you have any side effects? Well, if you like this video, please comment below, hit the like button, and subscribe so you can keep supporting me in my efforts to spread integrative medicine throughout this world. I'll see you guys next time.